Welcome, comrades. Thank you very much all for coming after a hard day's marching. It's the 4th of March, Saturday. We're just after the People's Assembly organised demonstration, Our NHS, which was specifically called and tabled to defend against the privatisation and the threats that our NHS is facing. I'm Ranjeet, Brar. I'm a doctor. I work within the NHS. I'm also a member of the Communist Party of Great Britain, Marxist-Leninist. And I'm very happy to say we've got a speaker who knows a great deal about the cloak and dagger activities of our politicians and some big business interests which lie behind the current threat that is facing the NHS. And that's Dr. Bob Gill to my left, who is also chair of the NHS Action Party. Bob, thank you very much for joining us.
Thank you.
I'll just say a couple of words by way of introduction before we let Bob speak, and he's going to give us a background of his information. He's currently making a film, which is the great NHS Heist, which he's going to allude to, and I hope we'll have a collection at the end to cover the cost of the meeting hall, and also whatever left over we'd like to pass on towards that movie, and we'll be also putting an appeal on our website to try and raise some more funds towards it as well, because I think it's a vital job that you're doing in trying to get that information out to a wider public, to alert them to the very real danger that our health system faces. Our party thinks that the threat to the health system is not unique. It's a part of the fact that the entire social wage is currently being cut, and that means social housing is under great threat. Your pay and conditions in work are getting poorer and poorer day by day and year by year for the majority of workers. There's a great deal of unemployment, and that is related to the profound crisis that our entire capitalist order is going through. I'll speak a little bit about that at the end, but I think in the first instance we're going to concentrate on the specific problems faced by the National Health Service. Until very recently I was a junior doctor. Many of you will have last year participated in a lot of actions around hospitals when the junior doctors were striking against the imposition of a contract, which essentially has been now imposed, basically because the junior doctors have tacitly gone along with it. And that will amount to about a 30% pay cut for junior doctors. And that's an enormous amount when you compare the cost of their training, cost of living, and the cost of living in a way which means you have to give a huge number of hours. Parallel to that, the pay and conditions of nurses are on attack. We know the bursary has been removed. And part of this entire process of reducing pay and conditions is all part and parcel of a larger aim, which is to make the delivery of healthcare profitable, to allow it to be parcelled up and packaged off and privatised. Again, I'll say a few more words at the end, but I think in the first instance I would just simply like to introduce Bob and say he'll be our main speaker and hand over to him. So Bob, thank you very much indeed for coming, and I'll hand it to you.
Thank you very much. So thank you, Ranjeet, for inviting me. I'll start with an introduction, and what I want to do is give you a background to how we ended up where we are and where we're heading, and what we can do about it. So my personal introduction, to my shame, I've never been politically active until about 3 years ago. I'm a GP. I've got 2 young children, 14 and 12, and small practice based just outside London in Sidcup. And about 4 or 5 years ago, we suffered the downgrading of our local casualty department. We lost the acute medicine, we lost pediatrics, we lost maternity. And pretty quickly I started to see the impact on my patients. I was finding it harder for them to get admitted. Patients were jumping back out of hospital no better than when I'd sent them in. And in 2014, I heard of a threat to another hospital only just down the road, Lewisham Hospital. And I thought, this can't be right. How can a government make a proposal which in my mind is going to put patients' lives at risk? This has got to be a problem. And at that point, I started to read up and educate myself in terms of what was happening to the NHS. I knew there was a problem, I read about PFI, Private Finance Initiative, back in 2000, and I thought it was an appalling scam. But you're too busy doing the day job. You've got a mortgage, you've got kids to raise, and you've got a job to get on with. But the threats to Lewisham actually woke me up. And there was a particular conversation I had with our clinical commissioning group chairman. He heard that I'd compared how the CCGs run to something not very democratic. So he rang me up to try and explain things to me. And I said to him, look, my patients aren't getting admitted when they need to. They're getting discharged prematurely. And I'm not happy with it. And he said to me, you're too sensitive. He said to me, I'm not hearing this from any other doctor. Your patients are just unlucky. And the final straw, he said, look, don't worry, you're not paying for any of this. And I thought, if that's the response of somebody in a position to represent patients and doctors, it's time for me to do something. I can't wait for these people to do anything. And in fact, how did we end up in this position? So the last 3 years has been a major awakening for me. And the good side is I've met a lot of good people, like Ranjeet. He's top of the league.
Explain to the audience about that, but it's appreciated. Good man, good man.
But I've learned something very damaging in terms of the sham of a democracy we live in, and how government works, and how corrupt the whole system has become. And I'll come into my personal experience of corruption later on. A group of us made a film 2 years ago called Sell Off, which is on YouTube. And again, this was a labour of love, and I ended up getting dumped on to finish the project. But during the course of that, you speak to a lot of well-informed people, whistleblowers, and at each stage, my eyes were getting opened wider and wider in terms of the scale and the deliberate, premeditated nature of the biggest scandal you could imagine, which is the privatisation of our health service. So along the way, I read a few books, The Plot Against the NHS. I started looking into, the research in terms of our system compared to the American system, compared to the European system. And the more I learned, the more I realized this is just completely against the public interest. There's absolutely no defense in terms of economic argument, medical argument, moral argument. And this is why, our politicians have gone to extreme lengths to cover up the deception, and to scapegoat others and to misdirect and divert us. But the more troubling thing is how all mainstream parties have been complicit in this deception, and how the deception goes back 20, 30 years, at least until back to Margaret Thatcher's time. So, in fact, the NHS has been under threat since 1948. Within the first few months of the NHS being instated, there was a group called the Freedom and Fellowship in Medicine, which was a group devised to get us to the insurance system. 1968, another pamphlet written by Arthur Seldon, who later went on to form Demos, the third way think tank, wrote a pamphlet called After the NHS. And then in 1988, we had another proposal by Oliver Letwin and John Redwood, both formerly of N.M. Rothschild's Bank, Privatisation Unit, who wrote their document, Britain's Biggest Enterprise, in which they laid out the sequential steps to get us from a public service to an insurance-based service without the public noticing. And what they had to do with New Labour Cooperation 97 to 2010 was various things, and I'll take you through what they had to do. The first and the key thing was to divorce control from power within the NHS, to instill a toxic bureaucratic layer on top, which will follow out political diktat irrespective of the impact on patient care and against medical advice. So you had this, what's called new public management, and this has gone across the public sector as a mechanism to bring market efficiency within public services. Well, that's a joke, market efficiency in terms of public provision. And the setup of this management structure broke up the hospital into separate units, surgery, gynecology, medicine, broke down the cross-fertilization that was naturally happening within the system, separated GPs from hospitals, and also went on to form the internal market. Again, another con. The fact that we were going to itemize and bill each other about services that we're providing for our patients some way was going to improve efficiency was a complete joke. In fact, the costs of running the NHS went up from less than 5% pre-Thatcher to above 20% is the estimates at the moment, and the US system, which we're heading to, will be 36%. 36% of your money will be heading to armies of intermediaries, either the insurance companies, the management consultants, the banks and the financiers, not being delivered to patients. So that's the bureaucratic change that they've instilled, and that has a significant personal impact on doctor trying to do his job. The next thing was to financially destabilize the NHS, and they used private finance initiative and the setting up of making hospital trusts having to declare a surplus at the end of the year. Have most of you heard of private finance initiative, hopefully? So this was another scam. The argument was to keep investment money off the balance sheet and borrow from the private sector at great cost, but we were told this was value for money. The major part of PFI scandal in terms of hospital building occurred under Tony Blair. He borrowed 11 billion and we all have to pay back 80 billion. At the end of 30 years, we still don't own the hospitals. The hospitals are still owned by the financiers. So we're paying a huge mortgage and we're left homeless at the end of the day. The other clever thing about PFI, the financing was structured to become more onerous later on in the life of the contract. So initially what appeared quite attractive has now become destabilizing to hospital finances. And don't forget, private finance initiative payments are protected. If you've got the choice between providing the patients with some service or paying the PFI, you have to pay the PFI. So you have the internal market, you have the deliberate financial millstone of private finance initiative, and then you have the breakdown of the NHS into something resembling an insurance system. And that's where clinical commissioning groups come in. So they replace strategic health authorities, and what you have are local budgets, local pools of money, which in due course will be transferred over to controlled by insurance companies. Again, every deception has to be sold with a plausible narrative, and the narrative around clinical commissioning groups was handing control to the front line. Well, it's done nothing of the sort. What it has handed is the axe, and the front line have to decide where the axe has to land. And then we had the Health and Social Care Act 2012, which effectively abolished the duty of the Secretary of State to provide health care, abolishing the NHS, and making it discretionary to local clinical commissioning groups as to what services they provide, and forcing out mandatory outsourcing of all hospital contracts. So now the hospital can earn up to 50% of its income from private income. So you have a funding structure resembling an insurance funding structure. You have hospitals geared up to take 50% private income, and you have general practitioners and local politicians set up to take the flak. Our national politicians have distanced themselves from the unfolding crisis that will occur. So where are we heading? Well, we have now in charge of the NHS a guy called Simon Stevens. Jeremy Hunt, Secretary of State, is a distraction. The 2012 Act gave power to the head of NHS England, Simon Stevens. The Secretary of State only issues an annual mandate. He has no day-to-day control of what's happening in the NHS. Simon Stevens has the control. Simon Stevens came from the the American health insurance industry, United Health. And United Health are geared up already to take control over the major part of the NHS budgets. So how will this occur? Well, you may have heard of the 5-year forward view, and you have to be able to decipher the jargon, because the first couple of pages sound great, how they love the NHS and how they love patients and they love the staff. But actually the language they use disguises the fact that they want to take us to something called a HMO, Health Maintenance Organisation. The other name is Accountable Care Organisation. But what that boils down to is budgetary control given over to insurance companies and administrators. And the way that will be enacted is the Sustainable and Transformation Plans, which breaks up England into 44 different areas. And each area is tasked with reconfiguring their hospital services. And the reconfiguring, what that will achieve is to centralize what is profitable, like cold surgery, joint replacement, cataracts, and what is unprofitable will be quietly shut down, and the need for those services will be miraculously soaked up in the community, because these people that don't exist will suddenly look after everybody who's left at home. Services like intensive care unit, services like accident and emergency will be shrunk away. Sick people will have a harder time accessing care. They'll have to travel further. And we know that the longer you take, if you're seriously ill, to get to a hospital, the greater your risk of dying en route. So this reconfiguration takes away the profitable and shuts down the unprofitable. The other thing they're selling is integration. Well, integration sounds great. But actually what they're really talking about is integrating social care budgets, which are largely privatised and mean tested, with NHS budgets. So you have this cross-contamination. You have charges brought in by the back door through the social care merger. Devolution, transferring control to local councils who have no expertise in running health services, and also setting up local councillors to take the flak. Along with complicit local leaders, local medical leaders. And then you have these new models of care. Now, new models of care, again, nobody quite understands where they're going if you read it as a layperson. But this is about downskilling. This is about replacing highly qualified people with less qualified people, cheaper people, easily to dispose of people. The junior doctor contract fits into that very well, because, again, it might seem hard to believe, but the junior doctor contract is designed to make doctors' work precarious, transfer clinical responsibility onto the doctor without the legal protection, be able to overwork doctors, and the biggest sting in the tail is no junior doctor, by law, has got whistleblowing protection. So if they raise concerns about patient care, they have no protection. And there's a case I could go on to later on, which is coming up in court on the 21st of March, which will highlight how junior doctors have been positioned without this whistleblowing protection. Very important whistleblowing protection. So with a contract like this, you can see why nearly 50% of doctors who finish training and enter into the first and second year of their training are giving up. This is an absolute disaster. We've spent thousands of pounds training these people, and they're either giving up medicine or emigrating. But to the government, this is not a problem, because it provides another excuse to shut down services. Oh, we don't have the staff. We have to rationalise. We have to close your local hospital. So you've got these various themes about gathering budgets together, downskilling the workforce, and setting up local representatives to take the flak, because we no longer have a national health service. It's become a local, fragmented, postcode lottery health service, for which the services that you get will be decided by your local clinical commissioning group, and they have carte blanche to decide what they choose to provide. And we're already seeing some groups deciding that they won't provide hip surgery if your body mass index is over 30, or they won't give you surgery because you're a smoker, or they will replace one cataract but the other one you've got to do without. So this is happening now. This is not something that we need to wait to happen in the future. So what we've done in terms of the film project that we're working on is to try and bring all these strands together and to try and wake up the general public and even the people who think, well, I'll be fine if I get private insurance. Because most people have no clue about how private insurance works in the absence of a state safety net. In the absence of the NHS, insurers are going to fleece the policyholders. If you're young, if you're fit, if you're well, they'll gather in your premium, no questions asked. But as soon as you become sick and expensive, then we go into a different phase where they access your medical records, compare it to your application form, and look for reasons to bar you from payment. And then they'll say, sorry, Mr. Smith, here's your last year's premium. Good luck, you're on your own. That's how insurance works. Insurance is about making profit and making the stock price increase and rewarding CEOs. It's not about providing care. The other scam with private medicine is this, the myth about competition, raising standards and improving everything cannot hold within a healthcare system. This was proven by Kenneth Arrow in 1963. He won the Nobel Prize for economics. He said there are fundamental flaws with applying market ideology to healthcare. Number one, you don't have a consumer who has the same knowledge as the provider. There's a complete disadvantage. So somebody who's vulnerable and sick is going to take the advice of the doctor. Now, unfortunately, when money comes into the provision of care, there's nothing stopping the doctor saying, look, we don't just need to chop your toe off, we need to chop your whole leg off. And by the way, chopping your leg off, I'll make a lot more money out of it. He's not going to tell you that part of the conversation. So this is called provider-led demand. This is where the people giving you care will either over-investigate, over-treat, over-medicalize. A good example of this is what happened in Florida. A nurse blew the whistle on cardiac patients in Florida. The FBI investigated, and they found out of 1,000 patients, 50% of them had unnecessary heart surgery. They had normal hearts. So not only did they undergo fraud, but grievous bodily harm. There's a long list of how the American insurers defraud the government through Medicare and overbilling, defraud the patients by not living up to their end of the bargain, and defraud the medical workforce by not paying them when they've done the work. These are the people our government, our politicians are inviting into our healthcare system with open arms. And the public and the medical profession are largely unaware of how insurance companies work, because in this country we've always had the NHS to fall back on. And that's one of the goals of our film. We've been over already to America, and we've spoken to some key people in America and got very powerful testimony in terms of how their system works. We've spoken to the founders of a group called Physicians for a National Health Program, Professors Himmelstein and Woolhandler, who've been campaigning for a single-payer system in the US for 20 years. I had a 2-hour interview with them. Every second of that interview is extremely powerful. My headache now is, what do I cut out, And it was spellbinding stuff. A lot of stuff I thought I knew what was going on, and really they blew my mind in terms of how corrupting this is, how demoralized the staff are there, how doctors are unable to do their job. They're spending 50% plus just doing the administration and trying to persuade the insurers to pay out when they should. We've spoken to another chap, Wendell Potter, who was an insider in the insurance industry, who was head of PR for the insurance industry, and he knows all the tricks. And again, he told us how everything is motivated about driving up the share price and driving down what's something called medical loss ratio. That's something these companies report to Wall Street. The lower the medical loss ratio, i.e. the lower proportion of money they spend on patient care, the higher the share price. There is a huge perverse incentive to deny patients care in that model. And this is something we hope to enlighten even the most selfish among us, that it's in their own self-interest to fight for our NHS. And I think I've gone on long enough. Thank you very much.
Bob, thank you very much for that really powerful and succinct overview of the pressures that our health service is under. I'm just going to add a couple of things, some things that came to mind directly really while you were speaking. The Lewisham Hospital campaign, I think, is worth dwelling on. I was actually working for Lewisham Hospital at the time. They were threatening to close A&E. And really, the threat to close the Lewisham A&E was the poison fruit of PFI. There was reorganisation within the whole of South London that was essentially based around the fact that two hospitals, one of which I'd worked at, which is the Princess Royal Hospital in Bromley, thank you, and others I hadn't. It was the Queen Elizabeth Hospital in Woolwich, both of which were massive PFI redevelopments. And it was in fact, and then they were, each of them in turn was failing, and sure enough they were merged together, and then they were merged with one more hospital locally which wasn't a PFI hospital, and then sure enough the whole three together were failing, and simply they were dragged down by the burden of debt for redeveloping their service as described by Bob under PFI. And basically it's between 6 and 12 times the initial capital outlay that's given to these companies to build the hospital in the first instance is the repayment. And actually we're very soon getting to the point where 10, 11 billion of the national exchequer every year is going to be being paid for the overall PFI debt, because it's not just hospitals, it's also schools, it's also prisons, it's also other public services, libraries. It was a massive windfall for the banks, actually given by, and let's not forget, by a Labour government, by Gordon Brown. Gordon Brown's absolute mantra, and in fact the Labour Party's mantra, has been that the greatest efficiencies are delivered by the market. And they absolutely forced through PFI after PFI. Frank Dobson had the gall, frankly, to come and address a meeting regarding, how awful it was that a Tory government was putting that A&E under threat. But absolutely, it was the policies that he introduced of PFI that directly led to that, burden of debt, which like a millstone is dragging the NHS down. And it's absolutely, as Bob has pointed out, not an accident. Since the days of Margaret Thatcher, they have been brainstorming a process to privatise the NHS. And it is a conspiracy because it's precisely against the interest, demands, wishes of the overwhelming majority of the British people, and against the medical profession. It's been the great honour. I know we have other people from the NHS in the audience, and I've only been working for the NHS since 2002 in the capacity of a doctor, and only recently became a consultant. But it's been a great honour to work for the NHS, where actually you can go to work and you're driven just entirely by the clinical need of the patient. Never once do they come and you worry about the cost of the treatment, the cost of keeping someone alive or not, the cost of having an operation or not. And if you compare that to some of, I think that Sicko is a very good documentary if you haven't seen it, by Michael Moore, where literally, people will turn up to hospitals and they can't afford to have all their fingers of their hand sewn back on, and they're picking how many fingers they can afford versus, whether they're going to have a home or whose home they're going to sell or how they can do their job or whether they can keep their car. And these are the real choices that people are making. And that's in the most developed and richest country on earth, though we know how unequal is the distribution of income in the United States, profoundly, as it is in the world. But if you go to the third world, if you really want, and anecdotally, my father is from India, and let me tell you, if you have money in India, you can go and you can have any scan, and people will throw unnecessary investigations and procedures at you, to the extent that there's no trust even between the very rich and the medical profession. They regard them as a kind of group of gangsters, who have this, language and knowledge and skill set that they don't understand as esoteric, that they know that they rely upon, that they need, but they profoundly do not trust. And then if you go to the very poorest in India, and I've got friends who did electives in Africa, and they would go and work in hospitals and they would come back virtually crying and it still really, makes me feel very emotional when I think about it, because they would have people who essentially would turn up with D&V, diarrhea and vomiting, who really just need a bag of saline, a cannula, a drip, a bag of saline to save their life or their child's life. And because they didn't have the ability to pay, in some instances, this actually genuinely they saw refused. And so it isn't just it's an abstract statistic. It becomes after a while that, in the world, 12 million children die every year of malnutrition and malnutrition-related diseases and lack of access to healthcare. But it's all driven by a profound inequality that exists in the world. I mean, perhaps it's a slight diversion, but it's very much connected to the ethos of the market. And if you push the ethos of the market, you can't escape from the consequences of marketization, and that is to concentrate wealth in a tiny number of hands. It amazed me actually to hear Oxfam statistics. And Oxfam couch it in terms of just unfair tax system. But Oxfam pointed out a while ago that 62 people had the same amount of wealth as half of humanity's population. Were you aware of those statistics? But recently, just in the last couple of months, they've revised that statistic. Through the crisis kills some capitalists, but it concentrates their wealth in ever fewer number of hands. And do you know what the number is now? Dan and I always argue about this.
6.
I think it's 8, but Dan thinks it's 6. But it's 6 or 8 billionaires.
6.
6 billionaires. Thank you, Dan. So, less than the fingers on your hand. That number of people.
Hands.
On your hands. That number of people, 6.
What about you?
Have as much wealth as 3.6 billion people. Thank you, Dan.
Should have just interrupted you.
Is that really true?
Yeah.
I hadn't heard it.
Yeah.
Got so
Yeah, one of them is Warren Buffett, one of them is Bill Gates. I mean, you can literally name them. 6 people have as much as wealth of half the world's population. And to imagine that they're all equal in the eyes of the law is profoundly wrong. And yet coexisting with that obscene amount of wealth and that obscene amount of poverty, capitalism is in a most profound crisis at the moment. So it's not an accident, and our party, is the only one I know who really pushes this, and this is not Bob's line, but I think it has to be said, right? That the NHS came into existence in a particular setting and with a particular set of circumstances. And it came into existence when actually there was a massive socialist camp in the world, particularly the Soviet Union, which had actually taken working people who were virtual slaves, raised them to be the ruling class, and given them a health system, education system, welfare system that was a shining example to workers all over the world. When they had been attacked and surrounded by that after their initial revolution in 1917, had fought it off, had stabilized, had built their country and economy, and in science, in medicine, in education, they became like this kind of beacon of research that drove the world. And I had professors who were quite conservative English people who taught me chemistry, who said, of course, in my day, if you really wanted to learn, you'd go to Russia and you'd have to learn, Russian. And I had to jolly well know that alcohol was alcohol, and he would tell me, and it was just an abstract academic thing. But this was in the 90s when I was studying chemistry as my first degree. You could meet these people who had been to Russia, who weren't communists, but had been drawn there because it was a beacon of progress and understanding. And then they fought off the Nazis. And they single-handedly, pretty much, destroyed the Nazi invasion and the Second World War. And that war itself was driven by a profound capitalist crisis. And during that capitalist crisis, their economy had been growing and working people's lives were getting better and better. And as a result, working people all over the world rose up and demanded something better and something more. And still we go to demonstrations, and even the junior doctors had called demonstrations last year where they had old people come and speak and say, after the war, they didn't give you exactly the background, but after the war there was a general mood. We simply said never again, we weren't going to accept this, we wanted more. There was a Labour government, and then the kind of general misunderstanding is, the Labour Party gave us the NHS. But in fact there was this Keynesian consensus, and the Keynesian consensus was essentially a truce. It was a truce between two warring camps, between the bourgeoisie, who wanted to hold on to power after the Second World War and did so all kinds of ways, by creating the EU to band together to maintain their power, by giving most power to the United States, all of these things, by creating the Cold War to stabilize things, by temporarily seeming very civilized, and by granting all kinds of concessions to their own working people. And it was in those conditions when, the ratio between the profit of, the ruling class and the workers was never, narrowed to the extent it was at that point. And as the social wage was given over to workers, and we got NHS, and we got social housing, and we had relative security, and we had relative prosperity, and we had free education. to all levels, actually, even within capitalism. It was done at the expense in our capitalist countries of more exploitation of the colonies, but it was done. And then, as the Soviet, and I won't go into the reason for the collapse of the Soviet Union, that really is too much of a distraction, but as the Soviet Union collapsed, as the leaders of the Soviet Union, in particular Stalin, who was the one who defeated Nazism, said we would see an era of the blackest reaction. And we have been living in that era of blackest reaction. And all of the social provision that was painstakingly won by British workers has been taken back through the miners' strike, through attacking workers, through attacking paying conditions, through casualisation of labour, through destroying social housing, through destroying our National Health Service. And the National Health Service is one of the things that we really cling on to as being a life raft in this country. So many people are dependent on it. The amount of desperation I see come through it from the poor people who are struggling to survive, and driven to alcohol, driven to drugs, driven barely keeping hold of their employment. People who won't have their operations even now, even though it's free, because actually they're worried that if they come in for any more medical care, they're going to lose their jobs, lose their house. People who go to food banks, people who are really on the edge. And really, this is something that the medical profession do see. They have a broad contact with society and are aware of the fact that even in our country, which is a profoundly wealthy country, there's a huge amount of deprivation and want that is making people's lives misery. And parallel to that, as they're cutting the National Health Service, I read a lovely book actually by Alison Pollock, which was called NHS PLC. She's Professor of Health Policy, I think, at UCL. And she wrote at the beginning of that, in contradiction to Gordon Brown, saying that the market was the best way of driving efficiency, said the market is profoundly opaque and unfair in its delivery. Its whole goal of capitalism is to make profit, and therefore it will provide services at a profit. And if working people don't have money, they won't get services. And I think that the NHS and the health sector is a particularly glaring example, because the consequence of not getting it are so dire: our disability, our death. And it really is the case that as services are being cut, as hospitals are being done away with, as services are being centralised, all under the mantra of increased efficiency, modern methods of care that mean you need less hospital beds. But actually there's no country in Europe that has so few beds per head of the population as England does. Their aim is to get down to 1.5. I think it's up to 2.5 now. Is ridiculously low numbers. And every single hospital I currently work in. When I first went only 15 years ago to work in the NHS, there was a little private ward, and it just happened, and people, there's a private ward, but there was a big overall service, and people came in for their operations. We weren't constantly in crisis. Year on year, I see every hospital I've worked in recently: St Mary's, St Thomas's, Croydon, Princess Royal, whichever hospital, from the very big, from the prestigious flagship hospitals to the district general hospitals, Lewisham, are all on virtually permanent bed crisis. There simply isn't enough of the service to go round, and it means a rationing. And even at the point, the 2000, I think it was 11 general election, just before the Condemned Coalition came in, 10, and the Labour government was kind of currently still in power, and big cuts were coming, and it was quite clear. They were openly talking about it, but not saying it was going to affect the NHS. I went to a surgical conference in Liverpool, and we had the head of the Royal College of Surgeons of Ireland, England, and Edinburgh sitting down, and they had a brainstorming session on how we could make those cuts. And they were quite openly basically advocating that we would have to lose staff, lose services, introduce rationing, or just go back to waiting lists. And even said, and of course there's an implication of having a waiting list, that a certain number of people will never need the operation. Well, they'll die while they're waiting. Mm-hmm. They'll die while they're waiting. And this is also part of our problem. That actually there's been a certain caste of our profession, an elite group of our profession, who have been brought in to the process of managing it. So most of the profession have been divorced from power, but a few of them, the powerful, have been complicit in that process of allowing privatisation to be pushed through against the interests of patients and against the interests of the medical profession, and certainly against the interests of the vast majority of the working people of our country. I don't want to be all doom and gloom. I do think that actually it's possible to change it, but I think we have to realise the level of the conspiracy, and I have to realise that it's not just a Tory thing, it's not just a one minister thing, it's a very joined up policy of our capitalist ruling class. And I think actually the Lewisham Hospital campaign is worth talking about again, because precisely I think that is pretty much the only effective form of action in stopping it.
Yeah.
Awareness has to be, greatly raised. People inside hospitals don't know about it. They really don't. The community doesn't know about it. But campaigns like the Lewisham Hospital campaign came together, and in really quite a vibrant way, were able to engage the staff and the local community in one large campaign that was politically very powerful, that couldn't be ignored, that had the very architects of the policy come and saying, this is terrible, terrible, how can we brainstorm it? And even though they haven't fundamentally got any answers, it's that kind of grassroots pressure from the working people in alliance with the health profession that really is the only way of safeguarding what's left of our system. It really is the 11th hour for the National Health Service. So the road of privatisation has gone so far now that essentially the NHS, as Bob says, basically almost doesn't exist. It's been balkanised. All of the different groups of staff have been balkanised. They have separate pay and condition, local contracts. The whole idea was to split the NHS up into little private, groups.
Clinical
trust. What are they called?
Foundation
trusts.
Yeah.
Absolutely, foundation trusts, which were individual business units, and it has been done. I think if we juxtapose that to socialist medicine, if you look at the American versus the Cuban system, America, it costs something like $7,000 per annum per person to provide care, unequal as it is. And it's extremely inefficient, and their health outcomes are really not good. They're worse than Cuba's, where it costs about $350 to provide care, and achieve the same things. So, obviously, I'm not simply an NHS doctor. I'm a member of the Communist Party, and I think that essentially what we're dealing with here is a profound inequality brought about by a capitalist system. But the NHS really is a model that tells you so much through its history about the relationship of class forces during that period, and how low really we have sunk now, precisely under the leadership of a Labour Party who claim to champion the NHS and the interests of working people, but as long as they go along, even under Jeremy Corbyn, with the mantras of the free market, they're absolutely powerless to do anything about it. Just as even the capitalist, if you're one of these 6 billionaires, not that you necessarily want to, but you have to act as capital personified. If your business is to make money under that system, with capital whispering in your ear, go on, you have no choice but to do those things. Our desperate need is to make working people realise this, to let them organise, and that really, I think in the last analysis, is going to be the way forward. I know that's not necessarily your position, Bob, and I know that there's a fight to be had to defend the National Health Service that I very much want to be involved in, but equally, I would appeal to people to get involved with our party and help to organise working people to achieve it. So I'll end there, and I think what we'd like to do is have some question and answer session with Bob that we can put forward with some of the data that he's put forward. So thank you very much.